Thanks, everyone. It's lovely to see some people here and to have a chance to introduce myself. Some of you may know me from previous work at Guy's and St Thomas's and at ETL. I've recently joined NHS England and NHS Improvement, leading on sustainable procurement and supply chain. So big agenda here. And I just want to tell you a little bit about what we're doing. If we could move on to the first slide, that would be fab. So this is just a bit of context here. You may be aware, I imagine you are if you're on this call, that the NHS published a Delivering Net Zero Health Service report back in October. And this really set out some of the pathway for our work and had some really clear targets and big commitments around what we're going to do. So we will be net zero supply chain by 2045. We will, by the end of the decade, we will no longer work with suppliers who do not align to or exceed our net zero ambitions. And these are exciting and big commitments. This is a bit about how we intend to get there. So within our program, we are looking at net zero, but we also are looking at stamping out modern slavery and how we integrate social value. Now, we appreciate social value incorporates climate change, but there's some other really important things around social value, tackling inequalities and social exclusion, well-being, that kind of thing. So our program covers all three of these issues. It's not just a net zero program. If we can move on to the next slide. Now, I won't go into all of this because this is kind of a big, busy slide, but essentially our vision is that by 2045, we see an NHS with a net zero, fair and transparent supply chain free of modern slavery. And this is our work plan. It's how we're going to get there. So we have 3 strategic objectives. We're going to be working with suppliers. We're going to be working internally with an NHS Improvement in England to make sure that we are giving the right guidance and support to the system. And we'll also be working with trusts and ICSs to roll these programs out. So we are developing some what we're calling playbooks, basically guidance, but hopefully guidance that provides really good information, breaks down all the barriers for things like walking aid reuse or device reprocessing, medical device reprocessing, so that at a trust level, you can start rolling these things out with confidence. Next slide, please. Some of you who are big studiers of the NHS report might recognize this graph. These are the 13 things, the 13 interventions that we've identified we need to do in order to get our supply chain to net zero. So at the bottom, the blue line shows where we are at the moment, far too much, and the green bits and yellow bits show where we can make a big difference. So you'll see in there things like process and product innovation, so that working with our supply chain to help them help us to improve the way that we do things. But also, we have things in there like reducing single-use plastics. That has an environmental impact, certainly on wildlife, et cetera, but it also has a carbon impact. Metal instrument reprocessing, device reuse, all of these things. So, we've got a lot of things to get to work on, and we'll be talking lots more about this much more openly in the public domain in the next few months. Next slide, please. Don't worry, I won't quiz you on this one, nor will I expect you to be able to read it all because it's all quite small. But this is our work plan. This is our 5-year work plan. It's just really to show the scale and the scope of what we're trying to do. This is I've worked in the NHS now for nearly 12 years, and sustainable procurement has always been that, that kind of hard to do thing, got put in the too hard box. And what we're trying to do as a team within NHS England and Improvement is take it out of the hard to do box and put it into the easy to do box, make it really clear, make it really easy to participate with, and support our suppliers to support us. So that's what this slide is all about. Next slide, please. Brilliant. So social value, this is really our topic of today. And what I will just go over really quickly now. I think those of you who are on this call are probably well aware of what social value includes, but just as a reminder, these are sort of the 5 pillars of social value as defined by UK government. So tackling economic inequality, fighting climate change, supporting COVID-19 recovery. I would like that to say a green COVID-19 recovery, but it doesn't. So well-being and equal opportunity. So we at NHS England and Improvement have been incorporating social value into our tenders over the last few months. As of the 1st of April, it's mandatory to go into every single tender, that a minimum weighting of 10% on every single tender needs to be on some form of social value. And this is a process that we're going through. It has varying levels of success, but we're really trying to test it out within the commercial team at NHS England and Improvement to make sure that we get it right before we make it mandatory across the system. The intention is that it will be mandatory. The minimum 10% weighting on social value will be mandatory from the 1st of April 2022 for NHS organizations. Great, moving on. So we are using, we're blatantly aligning to the government standards. We don't want to create a whole new process of addressing this. So we're aligning to the procurement policy note that was published in June last year by central government. We are looking to, however, understand what health needs specifically within social value and how we can align to that. So we've got some workshops coming up in May and in June to really hash that out with stakeholders and NHS procurement people who and not just procurement. We want to understand from everyone what we think needs to be in there specifically to health. Moving on to the next slide, please.
Just one or 2 minutes to go, Alex.
Perfect. This is my last slide. So just as I mentioned, we've got some workshops, some social value health module workshops to clarify that in May and June. Over the summer of 2021, we will be engaging with our supply chain more formally, not in a formal consultation, but more in a sort of getting their feedback on our plan, understanding where they are and whether they're prepared to support us, where there might be some gaps in their skill set. And obviously in November 21, we've got COP26. So that's another preparation. Thank you, Rachel. So the workshops are for NHS people, but if you're keen to attend, let me know. I think if you move to the next slide, Gwen, that's my last slide. It's got my email address on there. Please let me know if you'd like to attend, and we'll have a look. We want the workshops to be small enough that they can be collaborative, but we are also keen to involve as many people as possible. So please do let us know if you'd like to join.